My name's Roy Albertalli, and I'm honored to be here, but I'm humbled just listening to people who've been through so much. And I think that I've been very lucky to have had an easy experience compared to most. Just a couple of things. I know I'm supposed to talk about what life is like with a total pancreatectomy. I have to kind of back up at that, but just a couple of things I want to just say. I want to thank Dr. Chabot and the late Dr. Stevens. I wouldn't be here without their kindness and understanding. And I know I drove them crazy at night trying to, with calls and questions, trying to avoid the inevitable and being in my state of denial. I want to thank my wife, Louise, who's everything. Dealing with my learning to manage the diabetes was probably harder on her than it is for me. Anyhow, let me tell you a little bit about my history. And then I was trying to think, why me? You know, why would Dr. Chabot ask me? And probably, I don't know all his patients, but I don't think there could have been anyone who would have been more resistant to a total pancreatectomy than I. So just a little bit about my history. I was diagnosed with a mass on my pancreas. I've had pancreatitis all my life since I've been a teenager. I can remember making trips to Korea when I wouldn't eat for 3 or 4 days because I didn't know the Korean word for pancreas when I was over there. So anyhow, I was diagnosed with a pancreatic mass in 2004. I was followed by Dr. Stevens. And in 2006, I was diagnosed with IPMN disease. He arranged me to meet with Dr. Chabot. Dr. Chabot, we talked about a Whipple. And he told me, but there was a good possibility that I could lose the whole pancreas with IPMN, and I told him, not acceptable. I said, if it doesn't look too bad in there, just leave it, because I really don't want to be diabetic. He cautioned me I had a Whipple surgery. He cautioned me that the IPMN could return, and in 18 months, it did return. As I recall, he wanted to meet with me in person to tell me those results, because I think he knew I was so resistant. My pre-Whipple mindset was, I would rather run the risk of pancreatic cancer than the certainty of being diabetic. I was concerned that being a diabetic would change my life. I drive race cars for a living. I teach for Skip Barber Race School. And I was really concerned about how that would affect my life. Dr. Chabot helped me make the right decision. It's a decision I don't regret. It's a decision that, quite frankly, I wouldn't be here today. As a matter of fact, until I got here, sometimes I forget that I don't have a pancreas. So just to share with you, those pictures are pictures that are taken since my surgery. But I don't know how to work this thing. I'm actually challenged. If it doesn't have a wheel and pedals, I'm not too good with it. Oh, those are something different, actually. Well, you can leave that. That's a funny story. I'll get to that one. Anyhow, one of my big concerns was about learning, being able to get back in the car and learn what to do and so forth. So what can I tell you about life after a total pancreatectomy? It takes, I can do everything I used to do before I had a total. It just takes a tremendous amount of discipline, so I have to prepare for things. I just have to make sure I prepare things. You have to learn about managing diabetes. You're a type 1, but you're really not a type 1. You're very different than a type 1. You have pancreatic enzymes to deal with and things like that. You need to take control of this and actually manage it diligently. I test my blood sugar probably 10 times a day. When I'm in the car, I test 17 to 20 times a day. My A1C is 5.6. So, it's manageable, it's doable. I do everything I did before. My life hasn't changed all that much. It's really important to find a good, I guess I can't emphasize enough taking control. There are a lot of good people out there, there's a lot of good information, but you have to take it and make it your own. You have to find out what works for you. So, you know, there are a lot of good endocrinologists, and some told me, oh, that's, I mean, here, the challenges we faced was trying to fuel the body for 2 hours, 2.5 hours, where you're running at 85% of your maximum heart rate in 140-degree heat at triple-digit speeds, and offset that then with the complications of the adrenaline rushes are just incredible and drive your sugar through the roof. So trying to figure out how to do that. I was very fortunate. I went to a number of good endocrinologists who told me impossible, can't be done, you can't do that. I found an endocrinologist at Columbia, Dr. Freeby, who spent countless hours with me to help me get to the point where I can manage that. So, you know, you have to find the doctors who are right for you. There are a lot of good ones, but you need that right fit and that really, really good fit. Another thing I'll tell you is having a buddy, I call it, someone that you can talk to who's been through this is really, really, really important. Because there are times when you simply can't control the sugar, you can't control it. And being able to talk to someone else and say, does that happen to you? And they say, yeah, it really does. And I thank Dr. Chabot for, you know, connecting me with someone. And who we talk to one another, and when we have our down days, and it just kind of helps you get through it, and that's really important. When I'm in the car, I have a meter in the car, and I test my sugar at fuel stops, you know, when I come in to get fuel and change tires, and I check my sugar. And just in terms of how your body interacts differently, there are some foods, you know, you'll learn that there are some foods that will actually blow your blood sugar through the roof. And there are others that should produce the same result, but they don't. And so really testing and understanding what works and how it works is really, really important. So I have a meter in the car, so there's actually a frustrating story, kind of an interesting story. But those are some of the things that I drive. Some of those are at Sebring. These are all post-total pancreatectomy. As a matter of fact, I had my pancreatectomy to total in August 1st, and I asked Dr. Chabot, could I race in September? And he said, could I keep you out of the car? And I said, no. And I did. So it was not too bad. The Whipple was a little longer, I will say that, before I got back in the car. Anyhow, the picture is kind of, that was a pro race at Lime Rock with NASCAR, and I finished third. And that's the picture up there. The guy up there on TV, he's interviewing me, and he's asking me, what happened? He said, you were 30 seconds ahead, and you finished in third place 30 seconds behind. He said, what happened? I actually lost 2.5 minutes in the pits. This was a 2-hour endurance race in 95-degree heat up at Lime Rock, Connecticut. And I lost time in the pits. What happened is I took my meter out to check my blood sugar, and I dropped it, and the batteries fell out. And so, as you know, the car is not exactly that big, and the mechanic was 220, and he's trying to lean in the car to get my batteries back to put them back in the meter. And we finally got a meter I checked my sugar because I still had another hour to run in the heat, and I wanted to make sure my sugar was okay. I do keep a little juice bottle in the car in case I need it. And so by the time we got out, it was a little late, and I learned that actually I have to put tape on the meter to make sure I don't drop it and drop the batteries. So he's saying to me, what happened? And I said, I dropped the batteries out of my meter. And he said, what kind of meter is there in the car? So I figured it wasn't something I could explain. So anyhow, life is great. I'm here, as Bob said, you know, I enjoy things with my family. The pictures before, pictures of myself and my family, which I don't think I would be here without for that. I know I wouldn't be here without Dr. Chabot and Dr. Stevens and Dr. Freeby and all the doctors who've helped me. What are some of my frustrations? You can't live without a pancreas. I can't tell you how many people tell me that don't believe me. When I say I don't have one, and they say you can't live without one, but you can't live without one. So I don't control my diabetes with pump. I can't use a pump because of the temperatures in the car. And there's actually, with the harnesses and the suit, there's just no place to put it. So I use a needle. And I sometimes get frustrated because, think about it, you know, usually you have to go to the men's room or something like that to kind of take a shit. Not usually the best place. That's kind of frustrating. But that's my personal choice. But life has been the same, right, Louise? I mean, it's just been great. So, and as I said, when I listen to some of the stories that all of you have gone through, I was kind of lucky. I got diagnosed early. Mine was found by accident. I was in a hospital for an ulcer because I was taking probably a bottle of Advil a day plus some Bextra because I had a rotator cuff injury. It hurt me when I drove the car, and I gave myself an ulcer, and that's how they found the spot on my pancreas. And a good doctor got me to Dr. Stevens. Dr. Stevens got me to Dr. Chabot, and Dr. Chabot got me to Dr. Freeby, and I'm here today, and life is great. And, you know, thank you for having me, but as I said, I'm humbled to be in the presence of people who've been through so much.